Well, just a few decades ago, contracting HIV, which causes AIDS, could be a death sentence. But while not the scourge it once was, the disease is still affecting one community disproportionately. On Your Side's Don White marks National Black HIV/AIDS Awareness Day by talking with a woman who's living with it and a doctor who's an expert at preventing it.
Mary Glenn has been living with HIV for 30 years.
It was less than a year after I had contact with someone who was positive that I found out that I was positive, so I was able to immediately get on medication.
Nowadays, in many instances, you can take one pill once a day and have this virus be well controlled. The goal of treatment is keeping that viral load, the amount of virus in one's bloodstream, to so low that it cannot be detected.
Dr. Mohammed Reza, medical director at Can Community Health in Jacksonville, says the goal of treatment is for the viral load to be so low in the bloodstream the infected person can no longer spread it. He also says you can take steps to prevent catching HIV.
PrEP stands for pre-exposure prophylaxis. To put it simply, it's like birth control, but it prevents HIV. It's one pill once a day, and if a person takes it consistently, they can decrease their risk of contracting HIV by 99%.
Dr. Reza says African Americans make up around 13% of the U.S. population, but are disproportionately living with HIV, making up 42% of new cases. Mary Glenn has this message as she enters her third decade living with the virus.
Just in my story, the idea is be tested so that you will know whether you are positive or not.
Dawn White, First Coast News, on your side.
Well, there's a new grocery store